So I'd like to, with this very ambitious title for 15 minutes, I'll cover three things. One is Sweden in the world, the other one is the world in Sweden, and the one in between I'm going to talk about the profound nature of the evolving scientific landscape and how my industry is moving with it. And I'll basically be adding to and confirming what the previous speakers have been saying about the gravity of those changes. You know, you see these ratings about which passport is the best to have. You know, how many countries can you travel to visa-free? You know, which is the best country passport to carry with you? And now Sweden is not number one for some reason. I think we may have avoided some ministers and kingdoms maybe by saying things. But what really matters though is the rest of Sweden's reputation. Because I've been traveling all around the world, and now mostly in Europe, every day somewhere. And everybody loves to talk about Sweden and Swedes. Okay? And we have a reputation in healthcare and in science, which is probably better than it's deserved. Okay? For instance, in the area of quality registries, patient registries, and we have real experts in the audience, people around Europe think that we are really applying these for everything. Okay? We have registries for everything, and we're using them to pay for medicines, for tracking outcomes and everything. And I don't correct them, they can have that picture. But, so this reputation comes with a certain responsibility, I think. So even though we're going to focus a lot today on science, we have to say, to be honest, and also for the record, that when we say what are the global health challenges, well, of course, we have still outstanding things to do with finding better medicines for dementia, other technologies for dementia, really getting to cure cancer and so on. But of course, the biggest, by far biggest health challenge we have in the world is that we have all these people that don't get healthcare and they don't get medicines. And what is good with the economic growth we have in the world, even though it's sort of retarded slightly, still what is happening now all around the world is that health systems, and countries are starting to set up health systems. So we've had, whether you go from China or Brazil or even poorer countries, you've had not really a health system. You've had people with money paying out of pocket and maybe some emergency services for everyone. Now everyone is thinking about introducing real health systems, a mix of primary care, secondary care, tertiary care. You have to do some kind of budget management, some kind of health technology assessment. And here, what we have to sell is knowledge and experience. So I think, leaving that topic of Sweden in the world, it's not only about science, this is also about knowledge about how to organize things. And here we have an export product. Everybody likes to hear about Sweden. In China, India, they don't want to hear about the US. Nobody wants to copy their health system. They would like to copy the Swedish system. And of course, we should advise them maybe not to copy exactly what we have today, but what we ought to have had if we implemented all the great proposals we put forward. The second point, before I arrive at the world in Sweden, is just to underscore what was said before about how, first of all, the sciences are converging. Okay, the little examples we had here before from the field of sarcopenia research and the QB-Tech example, shows that what we are looking at here is not only medicines or only medical technology the way we defined it. It's actually a suite of services. It's a number of technologies. And this also creates a challenge, I can tell you, for the pharma companies, big and small, because we now find ourselves in partnership, or maybe in competition even, with the tech sector. And you have all the data people showing up. And I'll come back to that at the very end, okay? So there are a number of people that are, I used to say, congregating in the same room. You have all the tech people, with all their apps and gadgets and sensors, somehow realizing that health is the new frontier for them, because that's untapped potential. And you do a lot of traveling businesses, you have entertainment, you have all sorts of things. But financial services have a lot of big data stuff and fast trading and everything. But health has been largely unaffected by the disruption we see elsewhere, thanks to the technologies. Okay? So everyone's coming to look at that. Everybody wants to be in that space. And of course, we are already in there. People in medical technology companies are already in this space. But we have to find a way to relate to these new players that we will also need. Because why are we so productive in research today? Why are our pipelines full
You know, we have fantastic optimism in this industry now. And I say again, big and small. This is not just big pharma. This is all the surrounding big and smaller ships in the armada. Everyone's very enthusiastic because of the breakthroughs we're making. And that thanks to technology. We have been able, we can do genome sequencing. We can do much better molecular targeting. Now the next era is going to be sensor technologies and implantable technologies for further data gathering. So I'll give you another example further to the ones showed earlier about how the technologies can be disruptive. I carry this around, it's starting to get a bit wrinkled. But this is not a Swedish hospital, this is an American one, MD Anderson Cancer Center, well known to be maybe the world's best cancer clinic. Okay, this is there, you can't see this in the back, but I'll hold it up. A network of hospitals with one goal, cancer, and then they've struck out cancer with a red line, and they have the tagline, making cancer history. Okay? Now, why can they say this? Why do they say this, and why is it that we actually see now that we can cure many cancers? Is that because of one individual product or medicine? No. This is teamwork. And in this case, it's actually not that complicated teamwork, because you're looking at probably a number of diagnostics and then a number of medicines from different companies. And if you apply them right and early, you may cure cancer. Now that we still have real issues here, because we need to find a way to pay for the combined use of these and share revenues maybe between different companies. Not easy. Our companies can't talk to one another about pricing. That's illegal. We are relying on the health system to foster that conversation. But if you take the other things that are in the pipeline, dementia was mentioned. So the phase 3 trials that are running now, so the late stage clinical trials, I know this is an elite audience, so you know this, actually include patients that are recruited before signs and symptoms. So this is based on disease history, family history, biomarkers, other things. How are you going to implement technologies like that? Now, if these medicines are marginally effective, okay, then it's maybe not a big issue, because then you use it in a few places. But if they're really breakthroughs, there'll be an expectation from people on the street that we know day one how to implement this. And right now, we don't really know. We have started as EFPIA, we have a huge public-private partnership with the European Commission called the Innovative Medicines Initiative. It's part of the EU research program. 5.4 billion euros, half of it coming from the Commission as money that goes to academics, not to us, and the other half is coming from our member companies. And just as an example, we have a big project now on this to figure out, once the innovation in Alzheimer's comes, how to implement it. And this innovation is not going to be just a medicine. It's going to be the software that somehow tells me that I'm a bit slow with my, whatever, iPhone tapping or something, similar to the QB-Tech example. So I will be sort of triggered, because we don't want TV advertising in Europe, do we? That, or a new Alzheimer medicine, go see your doctor. No, we don't have that, and we don't want it. So we have to find other ways to organize the health system with these service providers, the tech guys, the apps, the sensors. Then you need to insert this technology. Then you need to find a way to track it, because I'm pretty sure that the payers are not going to pay up front when the effectiveness is unknown. The long-term effectiveness is unknown. So we have to find a whole new financial model for this sort of long-term payment. Same thing is if you come with a cure, as we just did with hepatitis C, fabulous medicines, but suddenly out of the blue comes a big expenditure that they want to budget it for. So we as an industry are really committed now to talk to everyone, what we say, downstream. So people that are the final recipients, the patients, the carers, the health systems. We talk a lot to the regulatory authorities. We talk a lot to the HTA agencies, the health technology assessment bodies, agencies like TLV. We work very closely, our companies talk to them during drug development. This is the next big challenge we have, is this translational challenge. So once when we deliver on everything that has been promised on TV, the citizens are waiting. Now we have to figure out how this whole new, these new batches of technology will be implemented. And you hear how I emphasize technologies. It's not simply medicines, not simply devices, it's the whole combination that has to come and be implemented. Which then leads me to my third point, which is the world in Sweden. And what is it there where Sweden should be, I think, and where it could be. And we heard earlier that you were absolutely right in your brief description of pharma and what's going on. We are indeed outsourcing the R&D. We found it to be more productive. Also, we want to de-risk. So we rather actually pay, my CEOs tell me that, they rather pay $4 billion for something next year, if they know it's working, than to pay 100 million now and take the risk. Because this volatility is not good for your share price. So anyhow, so there's a big offloading of research into the broader community. And the other thing that's happening is, as I mentioned, the networking, the collaboration. Competitors go together. The next Alzheimer's trials will be done with 5-6 companies doing one joint trial with different arms, so that you can afford all the measurements you need to do with big data and everything, plus only one placebo arm. Okay? This would never have happened 10 years ago. So networked innovation is where we're heading. And there are there are a couple of hot spots in the world, and it just happens to be that 2 of them have the same name. One is in Massachusetts, the other one is in, what county is it in the UK? Anyhow, you should know that. Cambridge and Cambridge, just as examples, okay? So everyone's in Cambridge. Now, all our member companies are there. European, American, everyone is there. And those that don't have labs, not all have labs. They have people with checkbooks. You want to be in there. You want to suck up the projects. You want to bind people to you so that if they work, you're going to be there. So that's amazing to see what happens. I was there with the Research Commission in Wedas in June last year to see how this works. And one of the things that I really took back home, and so did he, was the skill sets and the integration of the universities, where you encourage people to mix and match curricula. So you actually encourage people from Harvard Medical School to take a year off to go do data science at MIT, and the other way around. Not sure how easy that is in the European systems or in the Swedish system. That's just one little example. Now, interestingly, go to the other Cambridge, where you see now AstraZeneca, which I still consider intellectually as it's half Swedish or a third Swedish. What they're doing now in Cambridge with their new head office, taking a huge investment, moving into and projecting themselves right in the middle. It's actually a very nice aerial photograph, which I could have shown, where you see this ecosystem in the UK, Cambridge, where a big company sets itself in the middle. And then they say, AstraZeneca's plan is to basically be open. Their libraries will be open to everyone working in the town. Big and small companies, people maybe not cooperating with them, and so on and so forth, because they want to be part of that innovation system. What are people then looking for? What are the industry? So pharmaceutical companies, we spend 120 billion euros on R&D every year, a third of which is in Europe. You have approximately a third of that as government money around the world as well, from NIH and European funders in Japan. Okay? All that money, where is it going? What are you looking for? Well, you're obviously looking for the brains. People with the brains, where are they? Brains in an environment where they can operate and innovate. But increasingly what we see is that what we're after is data. It's data. It's data, legacy data, because we need to figure out what this mapping actually means. Whether it's the microbiome or the connectome or what a proteome, you need to link that to health patient data and the historical information we have to figure this out. But let's not be obsessed about the legacy data, because that's also complicated with all data systems and everything. Going forward, we're looking for environments where you prospectively will have consumer and patient-generated data. Then we're talking big data. Those environments where we can do that and have this integrated in the research environment, that's where we want to be. And that's where people are going to. And I've been very happy. I follow Sweden from a distance, but I've seen a series of announcements just in the last year or so from several of our member companies, from AstraZeneca certainly, from Janssen, from MSD, American Merck, here in Stockholm, and I'm sure there are other investments around the world. But I tend to remember the one that involved Karolinska, as I used to be on the board for a while. So there are very positive signals. Now, I think that there is a unique chance for Sweden to also signal this ambition and willingness to be there at the forefront when big data comes to healthcare. We want to be there, and we have a signaling opportunity, of course, with the government bill that will come in the autumn. We also have a chance in the areas of within the healthcare sector. I have learned that Health Minister Bergström announced the other day that by 2025 Sweden should be the world leading country in e-health. Yeah, what does that mean? E-health, e-health, m-health as we call it. What is that? Well, there has to be two sides of that coin. One is that of course you improve efficiency of healthcare and you cut queues and people are happy and consumers are happy and so on, you know. But it also has to be a research side of it. So and this, I don't see this really. I see the vision is slightly there in the UK, but they made some grand declarations about every NHS patient is a research patient. Didn't really work out that way, and they didn't have the population with them. Bad homework, okay? But I don't really see this anywhere where anyone with credibility, a country, a health system, that will actually say that as we do these investments on e-health, m-health, patient-generated data, using the new tech, we're going to do that for two reasons. Both to make healthcare better, but also to attract research and innovation and entrepreneurs to our country. So there's a huge chance over the next few years, because all this roaming around money, 150, 200 billion and counting, because when tech moves in big time, you know, it's even more. And Sweden has a great chance to be there. So thank you very much for the attention.